Stem wave, I like to say, it's a non-invasive way to recruit the body's own stem cells to accelerate healing without the use of a needle or some sort of an injection. We're basically taking the body's inflammatory process and making it anti-inflammatory. We are decreasing the pain and also changing tissue to recruit the stem cells.
Welcome to the Haque's Health Hacks Podcast, your trusted source for wellness, fitness, and healthy lifestyle insights. We believe in empowering you with knowledge to take control of your health. Join us as we explore the latest in self-care, share expert advice, and guide you on your journey to optimal well-being. Let's embark on this path to a healthier you together.
Hello and welcome to this podcast. We are going to be talking about something really, really exciting today. It's something called stem wave or shockwave therapy. Not sure if many of you out there have heard about this, but this new modern piece of technology has been a game changer in my practice with my patients who have chronic pain and conditions that they just alters their life. And so with me today, I'm so excited to have two amazing guests. I have Dr. Sam Wagner, who also has stem wave in his practice, and he treats a lot of athletes, and he'll share a little bit more about how it works and some of the technology so we can break that all down. And I also have a dear friend and patient, Kevin Nix, who's joining us today on this podcast to share a little bit more of his experience personally of using stem wave with some of his conditions. So I want to dive right in and thank you both for being here. Dr. Wagner, just to welcome you, if you could give us a little background of, who you are, and also, for our listeners who've never heard of like stem wave shockwave therapy, like what is it? How is it different from traditional, chiropractic treatment and things that, I'm sure you get asked like I do in practice from patients all the time.
Yeah, absolutely. Well, first off, I want to just say thank you for having me. Super excited to be here. So I am Dr. Sam Wagner. I am a soft tissue and a rehab-based sports chiropractor in Wisconsin. I own Rehab Lab Wisconsin, where we treat professional athletes all the way to your 90-year-old athlete. And adding it in stem wave has been a great addition to our practice. We like to use it with a bunch of different modalities that are either soft tissue related in conjunction with chiropractic adjustments. And it's been incredible with the results that we've been able to see as far as pain relief, which I'm sure you've seen in your practice, and also function, increasing function, and not only getting out of pain, but staying out of pain and creating treatment models that last and work long-term.
Exactly. That's how I feel like it's been in my practice too. Just that game changer of really giving the next level of quality of life on a more consistent basis to our patients. So, Doc, explain, like, if you could just walk us through, like, what is stem wave? How does it actually work? Maybe even on a cellular level, like what's happening in the body, when someone's actually receiving this type of treatment?
Yeah, absolutely. I mean, I love to talk about this stuff. So if I get a little too nerdy, please just tell me.
No, nerd out, please.
Yeah. Okay, perfect. So stem wave, I like to say, it's a non-invasive way to recruit the body's own stem cells to accelerate healing without the use of a needle or some sort of an injection. We're basically taking the body's inflammatory process and making it anti-inflammatory. We are decreasing the pain and also changing tissue to recruit the stem cells. So from a science level, when we talk about stem wave, and for my folks that like the science, macrophage 1, when macrophage 1 gets stimulated, it's usually because of some sort of a bacterial, physical, viral damage in the tissue, in the cell. And what shockwave is going to do, specifically stem wave, it's going to convert macrophage 1 to macrophage 2, which is going to trigger something called the T helper response. And that's going to create something called angiogenesis, which is new blood cell growth. So a big rush of new blood flow, blood cells to that specific damaged tissue site. That's going to create more of that regenerative effect with the treatment. In addition, it's going to stimulate something called toll-like receptor 3, which is a receptor from mRNA that's leaked when there's a damaged cell. And that tricks the cell to activate more of the mesenchymal stem cell release to flood the area with our own mesenchymal stem cells with the increased blood supply. It's just a great thing to help heal tissue. And that's all through a process called mechanotransduction. So when I tell patients that don't want the sciencey part, we are taking your body's inflammatory response, making it anti-inflammatory. We are creating new blood cell growth to help with the tissues. And then we are also recruiting your body's own stem cells to heal that specific damaged tissue. So in a nutshell, that's how I like to explain it, because it's honestly such an amazing tool that for patients to experience it and feel it, and then they know what's happening. It's just great tool to just explain. And the best explanation is them experiencing it themselves.
Totally. And Doc, just, I think you and I are on the same page with macrophages, but for some of our listeners who have no idea what that is, it's like, if I'm correct, just explain for our listeners, it's basically your body's immune response. Macrophage 1 is what your body will like connect. Like it's what's produced when it has an immune response to something going on. Just so like, just general to understand how that process works is what you were explaining earlier, which was like, I love the science behind it because I get it, but I'm thinking some of our listeners be like, what's a macrophage? It's basically part of your immune system's response, the first start of what's happening next before it creates inflammation. Because truly, most people don't realize that inflammation is actually your body's trying to heal something. However, our bodies don't know how much inflammation is necessary. And if it goes into inflammation too much, that's what really keeps us in this chronic state of not really healing the way we want to. So it's part of like the process of like slowing that inflammation down, even though inflammation is originally good. Like you bang your elbow on something, you want new blood flow to come inflame that area to help treat it, right? That's really what we want to have. But when it stays there for too long, that's when it really wreaks havoc on our life and our quality of life and our ability to heal fully. Am I correct? Or is that?
Yeah, absolutely. No, you're 100% on board. And a lot of people think, well, why do we want to send more blood to the area? What comes with the blood is oxygen. And when we have damaged tissue, it's basically like the analogy I like to tell patients is what happens if you don't have oxygen? You suffocate, right? Mm-hmm. Same thing happens with our cells and our tissue. When we have damaged tissue, it's damaged because there's not enough oxygen to heal it. So This is a great way to send more of that oxygen, send more of that blood flow. Again, inflammation is not a bad thing, but if we are able to use it to our advantage, then it's a great asset.
Correct. And then I'm curious. I mean, I know why I chose StemWave in my practice from doing some research. I actually also chose, shockwave therapy, StemWave in particular for my own lower back, because, as a chiropractor, I'm sure you know this too, Dr. Sam, like, grinding over patients, it's very labor intensive. And so I'm guessing you're like me, where you probably had some issues maybe in your back, hopefully not, but that was something that I wanted to do for my own body, and getting adjustments are amazing. But like things like laser or electrical stim and things like that, it's not an equivalent. So, why did you choose this over other modalities like laser or things like that,
Yeah, that's a great question. So I used some of those other modalities, but I was still feeling like there was something else missing as far as patient results, return to play protocols. Like you said, I work with quite a few professional athletes, and it's always about what's going to be best to get them to a spot where they can perform and not have to worry about a setback or re-injury. And StemWave definitely was what I was seeking. Even some of those stubborn cases, right, where we've kind of exhausted all options. We're not just getting to that point. What's something else that's missing? Utilizing this technology has been amazing. And I was first exposed to it. My brother talked me into running a half marathon with him. And so I started training for that, and I started to have this foot thing. And right, you think you know all the things and how to treat yourself. And I wasn't really pushing the needle too much. I wasn't getting better as quickly as I would have liked. And another one of my friends who was also a doc I knew had access to this technology. He used it on me, and then I was hooked. It was like, everyone needs to get access to this.
Totally. Actually, just side story on that, one of my dearest friends who's also a chiropractor in Southern California, she introduced me to shockwave therapy and said, oh my God, my lower back's, my sciatic's been kicking up. And I found someone she actually has not stem wave, but something similar, Shockwave. And, it really helped her with her sciatica. So that's what led me to be more interested. And then I learned the difference between soft wave and stem wave. And actually was going to ask you a little bit about that too. Like there is a lot of confusion out there, even from patients that come in and see me on what stem wave is. And they sometimes confuse it, thinking it's, radial waves, it's ultrasound, so, if you can speak to that a little bit on the differentiation and, what really stem wave is and how it's different from some of those other modalities.
Yeah, definitely. So stem wave uses something called electrocorporal or electrohydraulic shock waves that are going to penetrate deep into the tissue to promote that healing and allow that to happen with the body. One of the major differences with other shock waves that are utilized is stem wave uses something called a focused lens, where being more focused, we can penetrate into the tissue and it's not going to just disperse. Some shock waves, when they hit the skin, they just disperse right away, where the stem wave has the ability to penetrate deeper at a depth of, I believe up to 7 centimeters. And then that can really be more accurately to target where those pockets of inflammation are to really promote that healing.
Correct. That's what I kind of usually say to patients too, Dr. Wagner, like that, focused waves allows us to direct a little more specific, especially for conditions that are not as dispersed, like we're doing a carpal tunnel or a specific area, for tennis elbow. It allows us to really get focused and even in a lumbar spine or the cervical spine. So,
Yep.
I love that explanation. So, what types of conditions are you usually seeing, best results with, stem wave, or has there been any like wow cases that maybe surprise you? You said you work with a lot of athletes, so curious about that for our listeners.
Yeah, I mean, quite a few sprain strains definitely have been getting great results with stem wave, rotator cuff injury. Honestly, then the non-professional athlete, right? Knees, hips, ankles, shoulders. There's one case in particular, and I shared this recently. Was that I had a woman that came to me wearing knee sleeves, bilateral knee pain for 10 years, was told she needed to get a double knee replacement, but she was in pain, waiting for whenever the surgery was scheduled in a couple months and wanted to try to do something about it. So she came in, I treated her, and then she started crying. And, this was a year or two into solo practice. And I'm like, oh man, what did I do? What did I do? And she hugged me. And when she was crying, and it's like, gets me choked up a little bit even talking about it. She said that was the first time she hadn't been in pain for 10 years. And all I did was one single 15-minute treatment of stem wave. So
Wow.
If there's any proof in the pudding, so to speak, right, that was it. And she didn't go through with her scheduled knee replacement surgeries because stem wave was able to help her get to where she wanted to go. So that is, when you want to talk about a wild case, that was a wild case for me, and just further reaffirm that everyone needs access to this type of treatment.
Absolutely. Yeah, that's an amazing story. I have a story somewhere similar that I want to share, just because I had a patient that came in the beginning when I first introduced stem wave into my practice, and she brought in x-rays of her knees and they were pretty much bone on bone, and both knees, quite a bit of arthritis, and she had trouble exercising, and her main goal was weight loss, and she was having trouble getting to her weight loss with that dieting, exercise wise, because she was in so much pain trying to do any kind of workouts, stairs. And so, I let her know straight out when we first started her treatment on her knees that, this is not going to necessarily give you that same pad back, in the treatment protocol. But if we can get you 70 to 80% better, feeling better, so that you can do more with your knees and more with your body, would you be happy with that? And she said yes. So we went in her treatment, and it wasn't actually until maybe treatment number 6 and 7, which I'm going to ask you about in a minute, where she really noticed a huge difference. She noticed some differences, but she was still feeling a little bit like, oh, I don't know, I'm still having discomfort when I'm going upstairs. And I said, just keep going. Let's keep following the protocol. But it was around session 6 or 7 that she had reported to me, wow, I really can tell the difference. I'm able to exercise. Going up and down the stairs is not so much pain. And then towards the end of her treatment plan, she's like, I'm 80% better. And I didn't think I was going to be this way until later on in the treatment plan, right? Because sometimes, you want to get results for patients. And I'm going to ask you about this too, Kevin, in a few minutes. You want to get results for patients immediately, but healing takes time. And even with StemWave, all these sessions, they build up upon each other to create that stem cells, to
Absolutely.
allow for the healing to take place. So, how many sessions, do you think the average patient needs? And how soon have you noticed they typically, get results? Because that's always a question.
Yeah, so I usually see really great results with patients anywhere from 10 to 12 treatments, upwards of 15, as little as 3 treatment sessions. We see some really good results. But again, similar to yourself, Doc, patients come to you because they don't only want to get out of pain, but they want to stay out of pain. And like you talked about, treatment compounds. So that's where I tell them, I'm very, very confident that we're going to get you out of pain. But our goal is for you not to have to come back because you stay out of pain. So in order to do that, we just need to continue these treatments. And 10 to 12 treatments really has been the sweet spot I found. And in our practice, we'll do as many as 15. And if that means we need to spread them out, that's okay, because we want to make sure that these effects last long term.
Absolutely. And, I know sometimes, like, a question I get asked, and I'm guessing our listeners might be thinking, that safety is also a big concern for patients. So are there any side effects or risks with StemWave, and like who may not be a good candidate for treatment like this?
Yeah. So if you are pregnant, as far as contraindication, active cancer, because we're stimulating more new cell proliferation and stem cell growth, we don't want to increase that. Those are the main contraindications. Obviously, we want to stay away from anything over the heart.
Correct.
But other than that, really, honestly, when someone comes into our office, StemWave has given myself and my clinicians so much confidence that we can help anybody, right? And so the contraindications or who it's indicated for, that list is not too small. Like, everyone can get a benefit.
I agree. I feel the same way. And in fact, I would say to many of our patients who ask about this, like, there are a lot more risks and side effects to medications, surgeries, injections like cortisone. And sometimes the worst side effect that you can get from StemWave is that, you're just a little sore from the new blood flow coming in at worst. And that's at worst. And that's very minimal, if that, I have had an episode where I maybe did a little bit too hard on the intensity and had a little bit of a StemWave hangover the next day, where I'm a little sore from, too many waves coming in or too much energy going in. That was like a one-time, trial and error on myself. But yeah, other than that, it really has been super safe and effective overall for the patients that we've been treating as well. So, I know that you work with athletes, like I said, weekend warriors, chronic pain sufferers. What's the most common reaction that you get after someone's maybe first StemWave session?
Yeah, honestly, the most common reaction that comes across is surprise and excitement, because patients in one session, their range of motion changes, their pain level decreases in one single session. And that gives them so much excitement and confidence that there's an actual solution, that they don't need to continually suffer, that there are other options rather than relying on some sort of a medication or an injection or going to the level of having a surgery. And that gets all compounded in those single treatments. And that's been one of the most common and the most rewarding expressions, I guess, to be a part of with the patient, is their excitement.
Definitely. I feel the same way. Like, I get, after the first session, some of the patients, when we're retesting range of motion, let's say, shoulder, for example, and they're surprised, like, oh my God, I can raise this so much higher. How is this possible? Like, so I love those reactions too, although it's not always 100% seen on the immediate. Sometimes it could take 24 hours. And like I said, sometimes depending on their condition and how much inflammation and the chronicity of the condition, sometimes it could take, like I said, a few more sessions to really get that wow factor. But yes, a lot of times we do get those wow factors, which is so great. Dr. Wagner, thank you so much for sharing that. Is there anything else that you wanted to share here for our listeners about stem wave or shockwave before I move over and ask Kevin some questions here about it?
Yeah, I mean, if you are suffering and in pain and you haven't found this treatment, go seek it out. It is well worth it.
Agreed. So well said. Thank you so much. And now I want to introduce, like I said, Kevin, who is someone who was maybe, a little bit on the fence. He's been a patient of mine for several years. And
Wait, I'm on the fence?
no, you were on the fence in the beginning, not now. I don't think
Okay.
so. So I know, hopefully not. So Kevin,
No, I'm not.
for our listeners, take us back to maybe before we did the stem wave on you.
Yeah.
And we did it on 2 areas. So I wanted you to share for our listeners, like, it was your lower back and your shoulder pain. So how was that before? Like, what was the pain like for you on a daily basis? And how long have you been dealing with those conditions before we did the stem wave on you?
So, Dr. Haque, I think, did we do the math? Have I been a patient for over 10 years now? Is that about right?
Yeah, that is right.
Okay,
that is
so
correct.
I'm a huge believer in chiropractic. Huge. But I would get back spasms. And, maybe I should come to your office more often for treatment. But the point was I would get back spasms. So you introduced me to stem wave, and I'll just be blunt. I haven't had a back spasm in 6 months, period, where it was chronic. To your point, doctor, when you're talking about like immediate, I think that's the thing for stem wave is you have to be patient. So when I had my shoulder done, my range of motion went from 60% to 85% in one session. But then you think, oh, my back is going to be great in like 2 sessions. And it wasn't. I had to be patient. I had to go through the 9 to 10 sessions. And now I'm on a maintenance mode. And I've never had a back problem since then.
And you do a lot with your back. I know that because we play golf together. And
we do. Welcome to the club. Back and golf are not good friends. They're really not very good friends. And so you would always chide me, like, did you go play golf? And I go, yeah. And I would be in pain. I will tell you, since stem wave, I have not had a back problem, ever.
I mean, that's
amazing.
Yes. And like, one of the times, and if we can just go in, just to be perfectly honest, I mean, there was a moment in your treatment plan where I know you were a little discouraged because you were getting better. You had some great results with stem wave, and then you had come in to see me and you were a little discouraged because you did have, kind of like a flare up in your back, and you thought, am I going backwards? Is this really going to work for me? I remember you and I had a little conversation about it. Like, sometimes, like, things in our bodies, when it's healing, it can, re-flare up. It doesn't mean that you've gone 10 steps backwards necessarily, but it can kind of make us think that way. Do you want to share just a little bit about that for our listeners?
Yeah, you nailed that. There was a moment, I think it was like treatment 6, where I went, oh, crud, it's not working. My shoulder was doing great, but treatment 6, my back was sort of like starting to act up a little bit. And I'm like, oh, crud, this is not working for me. And you did a fantastic job, as you always do. Just sit there and go, be patient, do more treatments. And I think I'm probably up to like 15 treatments now, in maintenance mode.
Yep.
My back has never flared up. And that's
amazing.
huge. I mean, that's huge. I mean, I had my shoulder operated on by like one of those Palo Alto, works for the 49ers, does all that stuff. And he even told me, he said, Kev, you're getting a free surgery because I kind of maxed out my, my deductible, but I'm not going to promise you anything. It's probably not going to be any better. And you know what? He was honest. It wasn't. After stem wave, it's like unbelievable what my range of motion is. Unbelievable.
And, on your, prior to doing the stem wave, the things that you tried, you already mentioned you did surgery on your shoulder, but did you even do like physical therapy or any other type of modalities to try to help you along the way?
I did. And it just didn't work. I have to tell you, you talked, doctor, about the magic moment. When I did my first stem wave on my shoulder, it was like, holy crow.
Yeah, incredible.
It was amazing. Now, back is harder. right? We
It
discussed
is.
this, Dr. Haque. There's a
Yes.
lot more moving parts, but the first session of stem wave on my shoulder, I went from 60 degrees of range of motion to basically 90 degrees in one session. That's when I was hooked. That's
Yeah,
like,
you're
this
like,
stuff works.
you're like, she's not just trying to convince me. This is true. You felt it in your own body. She
No,
improved it.
I
Yes.
was I was skeptical. You're sitting there going, well, we'll do your shoulder. You know, I was doing my back, and you're like, well, just try the shoulder. You gave me a freebie.
Yes, I
You
did.
basically
Because
said,
I
yeah,
knew
let's
you
just
would
try the
find the
shoulder.
value. Yes. And that's how much I believed in it.
Then I'm like, sign me up. I'm in. I'm all the way in. It was that moment, doctor, where you're talking about, like, when you get a patient. It's not
Yep.
going to happen for everyone, right? You can't expect one session to be magic.
Correct.
But this one session was magic. It's pretty cool.
And, I'm so happy to hear that. I love hearing that. And, some people are nervous about even like experiencing stem wave. So what did it feel like for you? Just for our listeners, what did it feel like? Were you nervous right before you were about to get the first treatment on it?
Well, I want to do a shout out to Thomas, who's a phenomenal technician.
Yes.
And you talked about stem wave hangover, Dr. Haque. You're a little bit of a glutton for punishment because
I am.
you can turn the knob as high or as low as you want. And so Thomas, the technician, is like going, is this okay? Are you feeling any discomfort? You can go as hard as you want to go or back it off. And I will tell you, I've never had any side effect. I've never had any kind of downside to the session. I did have one stem wave hangover, I guess as you like to call it, where I kind of went for it. See, this is when you get studly, right? You're trying to be tough.
Me too.
And you're like, you don't need to be tough. It works. It works not at full throttle. So,
Correct. You don't need full throttle for the results. And that's a lesson that I had to learn too, because yes, you're right. You know me a little bit that I kind of go hard with a lot of things. But more is not always more.
yes, Spinal
So-
Tap, you don't have to go to 11.
No,
You don't have to do it.
exactly. So like paint a picture for us. What can you do now with your back and your shoulder that maybe you couldn't do like 6 months ago, besides the back spasm?
I would just say my quality of life is like an order of magnitude better.
Mhm.
By the way, I'm not getting paid for this. This is a
No.
freebie. I am all in on, and my daughter has a doctorate in physical therapy. And I said, Valerie, you need to like really investigate this. This is like a game changer. Those are the two words that always come into my mind on this whole technology. It's a game changer. It's unlike anything. I've done the Vibra, ultrasound, we have the little stickies on your back and stuff. And yeah, it's kind of okay. This is like night and day. This is like an amazing difference to your quality of life.
Agreed. And I'm so glad you brought that up, Kevin, because like I get that misconception from patients all, I've tried stem wave. And then when I dig in deeper, I'm like, you've tried stem wave?
Right.
And they're actually confusing electrical stimulation,
Right.
the TENS unit, or ultrasound, thinking those ultrasound is the same as stem wave. And it's absolutely not the same thing. It's completely different technology. It's a different level of depth, as Dr. Wagner had mentioned. And I appreciate you sharing that. So, for anyone who's listening, or maybe who's on the fence, Kevin, coming from you might be more powerful than from myself and Dr. Wagner. So someone who's maybe scared, maybe of a new treatment or tried all these things, what would be your piece of advice for them?
Try it. I've had no side effects. There's no downside. And in the case of my shoulder, to your point, doctor, you get this like weird magical effect. The back took longer. It took like 10 sessions for really the back to really, because it's pretty complex. I don't need to talk to you two about it. But my shoulder in one session was like, holy moly. I mean, I was skeptical. I'm like, yeah, okay. Yeah, it's another technology. Yeah. Click, 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 bang, 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 and then it's like, whoa, it works. That's what you care about as a patient, that something is actually working.
Yes, and you can feel it in the quality of your life.
Totally. My
Yeah.
quality of life is up like an order of magnitude. I mean, I would be, Dr. Haque, there'd be days where I go, my back is gone.
Mhm.
I have not had that for months.
No, and it's been even easier to even give you adjustments since you've been doing the stem wave because, things are healthier in there. Like I feel like you've progressed even more with your adjustments, which is also, just taking you up another level. So,
Yeah,
yeah, thank you so much for sharing that.
you
I
bet.
really appreciate you sharing that because I think that, coming from myself and Dr. Wagner, we have all this science background and we're so invested in it. But hearing your quality of life and what you really experience firsthand, just as a patient and not, have anything to gain except for what you gained from it itself is very powerful to hear. So, final thought I wanted to ask maybe you, Dr. Wagner, before we close up our podcast today for our listeners, where do you see stem wave going possibly in the next 5 to 10 years?
Mm.
Yeah. If you are a clinician and you don't have this technology in your practice, then you are going to be behind.
Mm-hmm.
It is going to be a staple of treatment that is going to be something that patients seek out regularly. And I feel like right now it's just starting to take off.
I agree completely. 100%. Well said. And I think a lot of people don't realize how stem wave, this type of therapy, is helping on so many levels of conditions. And I mean, even though in my practice, I'm not using it for more than musculoskeletal, because it is a healing machine. People, I've heard things about scars being held, ED being addressed through stem wave, because it's a blood flow issue, right? So there's so many other conditions beyond just pain relief. I see that might be in the realm of our next few years of how we're going to see stem wave being used as beyond just for pain relief and treatment for healing tissue. So amazing stuff. It's been such a pleasure and such an honor to have both of you on with me today for our listeners to learn more about it, hear more about it, because it is definitely something that I think we're all going to be talking about and hearing about and hopefully utilizing so that we all can live healthier, better lives. So thanks again, gentlemen. It's been such a pleasure.
Thank you.
Absolutely. Thanks for having us.
Yep. Thank you.
Thank you for tuning in to the Haque's Health Hacks podcast. We hope today's discussion has provided valuable insights into achieving and maintaining your health. Remember, your well-being is our priority. Visit us at hawkechiro.com or call 925-960-1960 to learn more or schedule an appointment.